Which of the following is a key characteristic of mental health? Correct answer is option B, ability to cope with stress. The most common symptom of depression is. Correct answer is option C, sadness. Which of the following drugs is primarily used in the treatment of schizophrenia? Correct answer is option B, antipsychotic. Which therapy is most commonly used for patients with post-traumatic stress disorder? Correct answer is option A, cognitive behavioral therapy. Which of the following is a common side effect of antipsychotic medications? Correct answer is option B, sedation. In which phase of the nurse-patient relationship is trust building most important? Correct answer is option D, orientation phase. Which mental health condition is characterized by extreme mood swings, including manic episodes and depressive episodes? Correct answer is option B, bipolar disorder. Which of the following is a key symptom of anorexia nervosa? Correct answer is option B, fear of gaining weight. Which is a common symptom of generalized anxiety disorder? Correct answer is option B, excessive worry and tension. Which of the following is a primary treatment for major depressive disorder? Correct answer is option B, antidepressant medications. Which of the following is an example of a defense mechanism? Correct answer is option D, all of the above. Which of the following is an indication that a person may be experiencing a psychotic episode? Correct answer is option B, hallucination and delusions. Which of the following is a common risk factor for developing schizophrenia? Correct answer is option C, genetics and family history. Which of the following is an example of a positive symptom of schizophrenia? Correct answer is option B, hallucinations. Which condition is most commonly associated with panic attack? Correct answer is option D, panic disorder. Which of the following is a risk factor for developing depression? Correct answer is option A, previous history of depression. In therapeutic communication, which technique involves repeating the patient words for clarification? Correct answer is option B, restating. Which medication class is typically prescribed to treat generalized anxiety disorder? Correct answer is option B, antidepressant. Which therapeutic technique involves assisting the patient to identify and understand their emotional responses? Correct answer is option C, emotional regulation. A patient with anxiety disorder may be prescribed which of the following? Correct answer is option B, benzodiazepines. A patient with obsessive compulsive disorder may experience which of the following? Correct answer is option A, recurrent thoughts that are difficult to control. Which of the following conditions is most often treated with selective serotonin reuptake inhibitors? Correct answer is option B, anxiety disorders. Which mental health condition is characterized by an overwhelming fear of being in social situations? Correct answer is option B, social anxiety disorder. Which of the following is the most common side effect of selective serotonin reuptake inhibitors? Correct answer is option B, sexual dysfunction. Which of the following is the most common comorbid condition associated with anorexia nervosa? Correct answer is option A, major depressive disorder. What is the first step in the management of a patient who is experiencing alcohol withdrawal? Correct answer is option A, administered benzodiazepine. Which type of psychotherapy is most commonly used for individuals with borderline personality disorder? Correct answer is option C, dialectical behavior therapy. Which of the following is a potential side effect of lithium commonly used in the treatment of bipolar disorder? Correct answer is option C, tremors. Which of the following is a common trigger for post-traumatic stress disorder? Correct answer is option B, exposure to a life-threatening or traumatic event. What is the first-line treatment for generalized anxiety disorder? Correct answer is option D, selective serotonin reuptake inhibitors. In a patient with schizophrenia, which of the following is a common symptom of negative symptoms? Correct answer is option C, lack of motivation. A patient with major depression has been prescribed fluoxetine. What should the nurse monitor for as a potential side effect? Correct answer is option C, sexual dysfunction. Which is a typical nursing diagnosis for a patient experiencing acute psychosis? Correct answer is option A, risk for violence, self-directed or other-directed. Which of the following is the primary risk factor for developing a substance use disorder? Correct answer is option B, strong family history of substance use disorders. The primary focus of mental health nursing is to. Correct answer is option C, promote optimal mental health and well-being. The mental health assessment tool commonly used to screen for depression is. Correct answer is option C, PHQ-9. Which of the following is the most appropriate response when a patient expresses suicidal thoughts? Correct answer is option D, take immediate action to assess risk and ensure safety. The main goal of therapeutic communication is. Correct answer is option B, facilitate patient self-expression. What is the main purpose of cognitive behavioral therapy? Correct answer is option B, to alter negative thoughts, patterns and behaviors. What is a priority intervention for a patient experiencing a panic attack? Correct answer is option A. Encourage deep breathing and relaxation. A key sign of schizophrenia is. Correct answer is option B. A complete disconnection from reality. What is the primary purpose of electroconvulsive therapy? Correct answer is option C. To treat severe depression that is resistant to other treatments. Which of the following is the best description of a patient's mental state in a manic episode? Correct answer is option B. The primary concern when working with a patient who has borderline personality disorder is. Correct answer is option B. Preventing self-harm or suicide attempt. What is the primary role of the nurse in the care of a patient with an eating disorder? Correct answer is option C. To ensure a safe environment and support recovery. What is the first step in caring for a patient who is experiencing a psychotic episode? Correct answer is option B. Establish safety for the patient and others. A person with dissociative identity disorder typically experiences. Correct answer is option B. Memory lapses and a sense of identity fragmentation. Which of the following describes an individual with narcissistic personality disorder? Correct answer is option B. A need for admiration and a lack of empathy. Which behavior is characteristic of a person with conduct disorder? Correct answer is option B. Which of the following is a key feature of narcissistic personality disorder? Correct answer is option B.